Okay, so good afternoon to everyone in the US, and good morning to anyone who's joining us from here in Australia. My name is Katie Haruno, and I'm here with Fiona Haig. And we are going to be talking today about the health impact assessment we conducted on the Trans-Pacific Partnership here in Australia. And we just wanted to start by thanking Krisha Crawling and Joshua Yang, who are part of the APHA Health and Trade Forum, for connecting with us and helping to put this together. We are really excited to share our results and talk to the US audience.
My name is Fiona Haig. I'm a research fellow at the Centre for Health Equity Training Research and Evaluation, which is at the University of New South Wales in Australia. Some of you might be able to detect that I'm not an Australian. I'm actually from New Zealand. And I've been working in the field of HIA for, I think, about 12 years now. I started off working in HIA in Germany, and then in England at a place called Impact at the University of Liverpool. And then I've been working with Tetra for the last, coming up 5 years now. And I'll just let Katie introduce herself. Where are you going?
I'm Katie Haruno. You should be able to tell from my accent as well that I'm also not Australian. I'm actually from the US, where prior to coming to Tetra, I was working at the Health Impact Project, which is part of the it's a collaboration between the Peace Charitable Trusts and the Robert Wood Johnson Foundation. I was helping to increase the use of HIA in the US. And then moved over to Australia about 2 years ago and have been working with Tetra on the HIA work that they're doing here. So it was a great opportunity to come here. And actually one of the first projects I did here was working on the HIA of the TPP that we're going to be talking about today.
So the way this presentation is going to work is we're kind of going to tag team it. So I'm going to start off talking a little bit about the process of the health impact assessment. And then Katie's going to tell us about the findings, and then we'll sort of finish off talking together about some reflections on the process. So I'll start off now. So just getting our slides going. Okay, so the Trans-Pacific Partnership Agreement is a trade agreement that's being negotiated between about 12 different Pacific Rim countries. It's kind of interesting because within these countries, there's quite different stages of development. So you have, for example, Australia, which has a GDP of about $67,000 US compared to, say, Vietnam, which has one of about 2,000. But they're all going to have the same sort of conditions if they agree to join this trade agreement. So negotiations began in about 2010. They've had 20 negotiating rounds, plus other sort of meetings that have been going on. It's in its final stages, but having said that, we've been hearing that it's in its final stages since we began this process sort of in late 2013. But it does sound like it is actually beginning to get towards the end. The agenda of the trade agreement is sort of primarily set by the US. It's a US-driven trade agreement. And it's going to be a big free trade zone in the Asia Pacific and beyond. Some interesting things about the TPP. There's a few things that are interesting about it, actually. First of all, these sort of modern day trade agreements are different than traditional trade agreements that used to focus on reading all the messages now, everyone's happy, that focused on basically setting up sort of free trade zones, so it was about tariffs, opening up markets, whereas these modern day trade agreements focus on a lot more things. So, for example, they have sections that are looking at intellectual property, requirements about dispute resolution systems, manufacturing standards. So they actually cover really broad areas and a lot more than just sort of traditional trade. And the other things that are interesting about them and troubling about them is they're negotiated in secret, so it's very difficult to find out exactly what's going on. And there's a lot of industry input into developing the trade agreement. You have industry partners even helping draft parts of the text, whereas there's a limited opportunity for public health input and citizen input. So against this background, we carried out this we decided to carry out this health impact assessment. So it started off originally that actually just a colleague of mine, Patrick Harris, met up with another Australian colleague called Deb Gleeson. Patrick knows a lot about HIA, Deb knows a lot about trade and health, and they got talking at a conference and sort of came up with the idea, wouldn't it be good to maybe do an HIA on this? And Patrick came back to the office and we talked about it, and we thought, oh, maybe this is something we could do. And so we got together and had a meeting and invited some people along. And so it started off as quite a small process that sort of grew bigger with time. And we decided that it would be useful to do a health impact assessment on the TPP in order to inform advocacy efforts around the TPP. Now, for those of you who aren't familiar with HIA, basically it's a process for identifying the future consequences of a proposed action. So, for example, looking at something like a trade agreement and trying to understand how that could impact on health in the future. So you're trying to understand how something will affect health and well-being, who it's going to affect, are there going to be winners and losers, but also what can we do about it. So at the end point of an HIA, you develop recommendations about how you can maximise potential positive health impacts and minimise potential negatives. So it's both a technical process, so you're gathering evidence, you're assessing evidence, you're coming up with a report, but it's also tactical in terms of it provides a process that you can use for engaging and influencing policy and stakeholders. So in terms of the structure of the HIA, we had a small working group which started off with Patrick, myself and Deb, and then we managed to bring along Katie as our research officer, and Katie ended up doing the bulk of the work on this HIA, and at a later point we had another person, Anne-Marie Thau, who joined the small working group. We talked to the Public Health Association of Australia, and they agreed to provide sort of overall kind of, in some ways, ownership of the HIA process. And so they helped us in terms of running a workshop, sort of setting up a workshop for us, and doing a lot of the sort of working with advocacy groups. And then in addition to that, we had a technical advisory group who was full of people who knew about trade and health impact assessment and equity. And then we also set up an advocacy advisory group, which I've got a slide on the next page, which shows the logos of not quite all of the groups who are involved in that group. I think there are a few more than that. And so this advocacy group, this was a new thing in terms of us doing HIAs, and it was made up of a mix of public health advocacy groups, but also consumer advocacy groups. So, for example, we had Choice, which in Australia is the main sort of consumer advocacy group. They publish like a monthly magazine where they do things like reviewing washing machines, but they also do a lot of advocacy work around consumer rights. So we had quite a mix of stakeholders involved. Now, in terms of the HIA process, it followed the typical steps in some ways in terms of we had screening meetings to decide, that we're going to go ahead with the HIA. We scoped out the HIA in terms of we had a meeting with the advisory group where we planned what we're going to look at and talked to the advocacy groups. And we gathered evidence, assessed it, developed recommendations. What was slightly unusual about it is that we developed scenarios in order to assess. And I'll just bring up all those. And the other thing that we did that was slightly different than a typical HIA process is very early on we also developed a policy brief. And that was because we were trying to fit this HIA around the TPP process. And that was back in sort of early 2014. We heard that it sounded like it was going to be finalised really soon. And we knew that our HIA wasn't going to be finished by then, but we wanted to get something out there already. So we did a sort of like an evidence brief that we released. And I'm going to talk a little bit more about the development of those scenarios a little bit later on. And so the whole process, it kicked off at the end of 2013. And originally we thought this was going to be, sort of like a 4 to 6 month type process. But it ended up taking sort of almost 18 months altogether, which probably isn't that surprising to those of you who are familiar with health impact assessments. And this kind of reflects what the TPP process looked like. So we had our HIA process, which in some ways, had sort of reasonably clear stages, and then we were trying to match that up with the TPP negotiating process that just seemed to be going backwards and forwards and was pretty hard to unpack. So as I mentioned before, one thing we did with this HIA was we developed scenarios to assess, because typically in an HIA, you have some kind of proposal, something that you can kind of get your head around and you can unpack, like, how is this going to impact on health? But here, since everything was negotiated in secret, we didn't actually have a proposal, we just had some leaked text. And then the other thing about the HIA, or about the TPP, is it only impacts on future policy. So when we were trying to understand how the TPP could impact on health policies, we had to try and develop ideas for what health policies were likely to be impacted on. So we developed policy scenarios based on the following criteria. So we wanted to identify policy scenarios that were either a current priority or likely to become a priority for advocacy groups. And that was because, this was an advocacy HIA, so we wanted to look at things that the advocacy groups were interested and could work with. And because we had limited time and resources, we also knew that we couldn't look at a really broad range of impacts. So we selected ones that there was a good evidence base for, so that we could come up with reasonably strong impact assessment findings and recommendations. And then we also looked at, sort of based on what we knew about the leaked text and from previous trade agreements, we needed to identify policies that were actually likely to be impacted on by the TPP. So the scenarios that we ended up identifying is looking at medicines at increased out-of-pocket costs for patients, tobacco, looking at marketing restrictions. In Australia, there's already a ban on, there's already plain packaging legislation, so we knew that wouldn't be affected by the TPP since it's already in place. So we were looking at future tobacco marketing restrictions that might be put in place. Alcohol, looking at regulation of warning labels and alcohol availability. And food, we were looking at regulation of food labelling, because that was an area that's, there's been a little bit of activity recently in Australia, and it seemed one that it was quite reasonable that there might be future regulation of food labelling. And so once we developed these scenarios, we developed them by, I should have said, Katie carried out interviews with people from our advocacy group and from our advisory group to help select these scenarios. And then we went and looked at the literature around them, and we sort of carried out a preliminary impact assessment, developed some pathways, how we thought the TPP could potentially impact on these policies and how that would in turn impact on health. And then what we did was we had an assessment workshop where we invited everyone in our two advisory groups and also other people along to look at everything that we had found and work with us with them. And so what we did was we had this workshop, and we had sort of three main areas that we looked at with the groups. So we presented them with summaries of the literature and our findings so far, and then we asked questions about do we think that the TPP will impact on this policy scenario? So in terms of what we were showing them, is it plausible? Do we have enough evidence? Have we missed anything? And then we wanted to look at what was the impact of those policy scenarios on health. So again, asking questions about, the preliminary pathway that we developed, was it plausible? Is this significant? Is this something we need to do something about? Do we have enough evidence? Are we missing anything? And also, who are the winners and losers? So asking those equity questions about, and are some of them more important than others? And then we also looked at recommendations. So recommendations for how we think the TPP should look if it goes ahead, but also recommendations on policy in terms of how the government should go about negotiating and dealing with the TPP.